Perfect. Hello and good afternoon, everyone. My name is Gage Woolley, and I am the program director for the Alumni Association in the College of Nursing. We're so excited to have you on our call today to talk about nurse-driven product innovation and the lessons learned. We have two wonderful presenters today, both alumni, both really involved in the product innovation space, and really just excited to have them on today. So I'm going to go ahead and do a quick bio of each of Abby and Mick, and we will go from there. So we're going to start with Dr. Hess. So Dr. Hess is a nurse practitioner, clinical researcher, and entrepreneur, at Cincinnati Children's Hospital and Medical Center, and affiliate professor here at the College of Nursing. She has led all phases of product development, and she is the current co-chair of the ANA Innovation Advisory Committee for Technology and Devices and serves on the UC College Innovation Advisory Board. She is partnering with senior and executive leadership at Cincy Children's to develop the structure, mentorship, and education for fostering nurses' engagement and innovation. She has presented on innovation topics for local, state, and national international organizations, including Cleveland Clinic Nurse Innovation Summit, Ohio Society for Pediatric Nurses, amongst many other organizations. Dr. Hess has received multiple innovation awards, including the first Johnson & Johnson Nurse Innovation Quick Fire Challenge. Really excited to have Dr. Hess on today. And then also excited to have Mr. Mick Hopkins. Mick is an alumni from 1995 and is a registered nurse with 28 years experience in critical care, emergency medicine, trauma, and 29 years of design experience. He has also led all phases of product development, and in 2017 founded a medical device innovation engine to deliver novel solutions that address unmet clinical needs. He holds 25 patents currently, read that again, 25, and has 3 innovation awards for his dual syringe technologies. We're really excited to have both of you on today. Thanks so much for being here, and the floor is yours.
Great, thank you so much.
Yeah, thank you.
Great. Well, I'm going to start off sharing the learning objectives, but Mick and I will really go back and forth and kind of share our experiences and kind of compare, contrast, and just kind of give you a window into the world of innovation. So what we're going to share today, we're going to identify some common barriers to accelerating nurse-driven innovation, particularly like in a large health system or organization. We're going to analyze strategies and some competencies that help promote nurse-driven innovation, and then really kind of demonstrate the belief that the value of resilience is really critical for unleashing nurse-driven innovation. We're going to integrate some of the lessons learned to help evaluate and help you select innovation mentors and champions that can really help make these initiatives successful, and then go through some competencies that promote nurse-driven innovation. So, ton of topics to share. So we're going to start off just sharing a little bit about why nurses are such great innovators. Nurses, we are experts at assessing patient and family needs, and we're really closest to the patient. So when you're seeing the problems and the challenges every single day, we figure out how to make solutions, sometimes just on the fly, sometimes MacGyvering things, sometimes going through formal processes to do it. But that really gives you critical insights into the problems and also potential solutions that could help improve healthcare. We're also the end users for so many medical devices, services, and technologies. And when you're the end user, you really are the people that are going to be using this product from day to day. So that's really critical as we develop new innovations, that nurses are engaged and are really able to be a part of that process. Nurses are excellent problem solvers. I know, like on my unit, I worked in the PACU starting off, and we would always say, like, if you need a problem solved, find a nurse, right? Yeah. Because they will figure out how to work through it and come up with something that works. So we just naturally do that day to day. And when you sort of take that and sort of scale it to something with innovation, that can become a really important skill set. We're also super skilled at collaborating with other disciplines. I think Mick's probably experienced so much too. Innovation is such a team sport.
Yeah, for sure.
Yeah, really being able to work across disciplines is something you learn early on in your nursing career. And as you move into innovation projects, that's such a critical skill. And so nurse-led innovation, when you bring the lens of the nurse to innovation, it really helps you to have innovations that are creative, sustainable, and equitable, because we're always thinking through all these different lenses as we care for patients. Practical and intuitive, right? If it can't be implemented and it doesn't work, we're quick to be like, can we find a different solution?
Yeah.
So when nurses are innovating, we're really thinking of what's going to be the best and most effective for our workflows and for our patients at the bedside. And then evidence-based, if you're coming at innovation from an area where you've never solved that particular problem, you have to do a lot of work to be able to understand the evidence. When you're working in clinical care, you're immersed in the evidence. And so you're using that every day. So that's really important because you naturally bring that lens of what the best evidence is into being able to figure out what the best innovation would be. And then, as we already mentioned, collaborative, and then empathetic. So many innovation frameworks start with gaining empathy for the problem, really understanding the problem. And as nurses, that's something that we naturally have because we're so immersed into the situation. So,
Yeah, and I think as innovators, it's the biggest thing is you have to fall in love with the problem and develop from there. So.
Absolutely. So if nurses are so important for innovation, what are the barriers? Like, why is it hard? And what keeps us from being able to innovate easily in healthcare systems? So there's a lot of different things that contribute to this, and I'll let Mick kind of kick off the list.
Yeah, it's a long list, so bear with us. So the first thing is limited access to resources. So, I did some deeper dive digging, when you're in the middle of innovation, once you look outside of what you're doing and seeing what others are doing, I was shocked when I saw that out of the close to 7,000 hospitals, only 110 had actual innovation centers. And I think that's critical there is because hospitals, the healthcare system's already stretched financially. So funding is probably the biggest part of all this. You either have money or time, and you neither have both at the same time. So funding, just lack of financial resources to support these projects, time, everybody's overworked these days. There's a nursing shortage ongoing, and that is only going to worsen here in the next, 5 to 10 years. So there's not much time at the bedside to innovate or to run a project outside. Technology. So a lot of these health institutions, they want to innovate, but lack those resources of rapid prototyping, having like a skills lab type deal where nurses can actually get what they're seeing at the bedside and then go in and try to design a solution around the problem that they're experiencing. And the other barriers are organizational culture. In 2020, the big catchphrase was innovation. But what Abby and I were discussing it some last night, and really it just needs to come from the top. And it's a top-down strategy, and to where you have to have buy-in from the leaders in the hospital to really support the innovation. So there's a lot of resistance to change. If you're working with a physician and kind of pointing out that you want to innovate, and we're discussing kind of sends the message that someone's doing something wrong, and that's not necessarily the problem. It's not that you're doing something wrong. We just see that things could be done a better way. So those are the two key things there.
Yeah, definitely. And one of the challenges also is the lack of training and education. There's very specific innovation programs, competencies, and skills that help train people in innovation. And so it's really critical that nurses get the right training so that you can become key collaborators. It depends on the type of role that you're going to take on in innovation, like the depth and breadth of knowledge that you need. If you're an entrepreneur like Mick, you have to know a whole lot of different things. If you're an entrepreneur like me, which is where you're working within your own healthcare organization, you need to really learn to understand kind of all the team members and the skill sets and all the pieces like that will help make your project successful. You don't have to be necessarily experts in all of those, but you really need to become an expert collaborator in being able to drive the project forward. And continuing education is one thing too. Innovation is constantly changing, right? And so having programs that help you to continue learning as you go about being an innovator. Communication barriers. I think anyone who's worked in healthcare has probably seen silos, right, at some point, or any large organization. And so that can be something that really needs to be broken down when you're working to create an ideal innovation center, is that these silos are able to be de-siloed and you're able to work really well across different disciplines and different departments and areas. And idea sharing, sometimes in innovation, there are certain things that you have to keep, that you can't share, publicly initially, or you'd be giving away your idea, but you also need to be able to be open enough that within your organization, you're able to collaborate. So finding ways to walk that line and be able to really partner and innovate well.
Yeah, so then that moves us into leadership support. So executive buy-in is key. Just not having that support and encouragement from leadership for the nurse-led initiatives can really not only kill the innovator spirit, but there's so many great ideas, not only from nurses, there's medics, PCAs, whoever's at the bedside, whoever's at the healthcare system. And that's the important thing, is anyone can innovate, but with nurses being the ones right there at the bedside, you want to encourage this and help build it out. And I think innovation isn't anything new. Nursing innovation isn't anything new, but it's growing rapidly. So finding mentors, lack of mentorship at these healthcare systems, you really need to find that one person or a group of people who are going to champion you and move you through the process. The other is regulatory and policy constraints. So we go to the next one. So compliance is just working through the regulatory requirements. It can be time consuming and daunting. And then policies, making sure that whatever we are innovating is going to align with the hospital's healthcare policies.
Yep, and adding to that a couple more. So incentive structures, those are so important, because you can have an innovation program, but if you don't have it built in to recognize and reward innovation, that makes it really challenging for managers to support it and for employees to want to take on those initiatives, because most things with innovation, even if you're given some time to do it, take extra time,
Yeah.
a fair amount of, or a lot of extra time. So it's really helpful when you're able to get some of that time so that you can think and you have the space and you can meet with people to be able to drive these initiatives forward. And then career advancement, being able to have that, like we have, career advancement for research and engagement with education and publications and all those types of things, having incentive structures that link to innovation, super important. Data and evidence, having access to data to be able to really, effectively evaluate innovation. And then evidence-based practice. There's a saying, I'm not sure exactly who said it, but innovation happens before evidence, right?
Yeah.
And that can be really challenging because we want to be very evidence-based in our care. But if we see something that's not working, given the current evidence, then you want to be able to innovate. But that's kind of this constant tug, right? To be able to really decide when you can test and trial and implement and scale. Depends on the risk of the innovation.
Yeah, definitely.
And so real quick, I mentioned this really briefly before, but I want to share just a little bit about my innovation journey, and Mick's going to share a little bit about his too, just to give some context to the work that we've done. But I've had the opportunity to work as an entrepreneur. I didn't even know that was a word until I'd been one for a few years. But an entrepreneur is someone who develops an innovative idea in collaboration with their company or employer. And so there can be pluses and minuses, right, to being an entrepreneur or an entrepreneur. We could give like a whole nother talk, hopefully, just on that. But some of the positive things with being an entrepreneur is that since you're still working within your healthcare organization, you have access to resources from the company for research and development. You have access to your target population and for clinical staff. So that allows you to kind of continuously get feedback and be able to do testing more quickly than if you were at an external organization. There's minimal financial risk to the inventor. So typically you're leveraging resources from within your organization. And then you always want to check. So organizations, if they have an innovation program of some sorts, have an intellectual property policy typically. So you always want to check and understand that and talk with others who have expertise in that area if you do have an idea or a solution that you're wanting to move forward. But inventors can receive financial compensation if the product is successfully commercialized, if it's set up for the system to be able to have that type of compensation, which can be really helpful. So lots of potential advantages with the entrepreneur pathway, but Mick will talk a little bit later about the entrepreneur pathway and some of the advantages to being able to do your innovative work through being an entrepreneur. So just really quickly to share a little bit about my story. So as a nurse practitioner, working in the preoperative area, I see kids all the time who are very scared to go back to the operating room. We have lots of different interventions that we use to help make this easier. But despite kind of everything that we were using, I was still seeing that a lot of kids went back to the operating room and were really nervous. Higher anxiety before surgery is associated with more negative outcomes after surgery, like emergence delirium, separation anxiety, night terrors, bedwetting. And some kids have a negative experience at the hospital, and it can carry on for many years, and how they feel about medical care and how they're able to tolerate medical care. So it's really important in that moment that we help make them feel comfortable, but also for how they feel long-term about coming to the hospital. And so with preoperative anxiety, we really want to kind of usually leverage a combination of interventions that help to make it as easy as we can. Because when the kids roll back to the operating room, adults a lot of times have an IV placed, so going to sleep is really quick for us. Kids don't like needles, right? And so oftentimes, if it's safe to do so, we have them breathe air from a mask and fall off to sleep. But you can imagine if kids get anxious in that moment and start to resist the mask, that can be really hard, probably almost harder sometimes than a needle, because if someone's holding a mask on your face for several minutes that smells really bad, that can be quite a struggle.
Yeah, and it sets them up for future visits. They're just going to be scared and uncomfortable. So
yeah, absolutely. So I was thinking about this problem, it went well for some patients, but a lot of patients still had a lot of very high anxiety. Even if they cooperated, they felt super anxious in that moment, probably like we all do if we've had surgery or loved ones have had surgery. How might we make this easier? And so my friend's little guy, when he was 3 years old, Owen, he came for a surgery, and he was not happy at all, right? You don't let them eat. So you don't feed a 3-year-old, they're never happy. And then you have them sitting in a room waiting to go back for surgery. So he was just kind of already really upset prior to going back. And so I wasn't sure that he would do well with the mask just because he already was not a happy camper with going back to the operating room. But when I later asked his mom how he did, she's like, he did great. So I was super curious and was like, well, how did you make that easier for him? And she said, well, I knew that Owen's favorite story was the 3 little pigs. And so I told him, when you go and put on that mask, you get to become the big bad wolf. And so you just need to huff and puff and blow the house down. So when this little guy got back to the operating room, he actually took that mask from the doctor and he huffed and he puffed and he was out like a light, like in several big breaths. And, I had heard our clinical team tell stories and really engage kids before, but it was super rare to see in a really high anxiety moment for the parent, for them to just like that, have a tool that could so quickly engage their child. And so it got me to thinking, is there a way I could help create this type of positive experience for any of my kids and any of my parents that come to the hospital? And what I imagined was creating a video game. So when you breathe, it would do different things so that the kids become really engaged and they get comfortable with the mask, and that they, when they fall off to sleep, it's just a much easier experience for them. So working on this project, there's a lot of different steps to innovation, right? What it took to actually get to the finish line, and the finish line can mean different things. So for this particular project, I define that as patented, licensed to a company, and used in routine clinical practice. To be able to get there, it was lots of obstacles and barriers. We had 5 rounds of funding, 7 years from the first grant to licensing, time, resources, commitment from our healthcare organization to help support this project. I did keep my day job. I was working as a clinician the entire time, also doing research projects and this innovation project. So this was kind of a part of what I was doing for 7 years. which maybe is part of why it took a while, but there's kind of all the things we were talking about before. There's a lot of different barriers when you're doing innovation. But some of the things that were incredibly helpful were partnership with our hospital's commercialization office. They had so much expertise that I didn't know anything about when I started the project. So being able to lean on them and have their support and figuring out all these different components of the project was extremely helpful. Also, a partnership with numerous external companies at various stages. And so for design and prototyping, and then actually, moving the product forward beyond that to get like a commercial version, different companies have different levels of expertise with product development. And so all of that was super important. And all these collaborations are why we ultimately were able to be successful. But I think kind of the key things for me in this entire innovation journey: collaboration, continuous learning, a lot of patience, and tenacity.
I was just thinking when you were going through this, after they hear your story and my story and the time frame that it takes to go from napkin sketch to get it all the way through, I always equate it to running a marathon, and you think you're getting close to the finish line, and then someone comes and picks you up and takes you back 10 kilometers. So,
Right.
but innovation is fun.
Yes, it can be so rewarding with innovation because you're in a new space and you're getting to break new ground. And I think when you have the systems and structures and people to support it, it's really exciting when you have all of those things in place. It's still challenging, but you can do such great things when you have the right structures and teams. And then one thing I was just going to really briefly talk on, and we'll discuss this just a little bit later too, is mentorship. Mentorship was such a critical part of this journey. And when I thought of mentorship, when I first started, I'd done research and I had a mentor, and they had a lot more experience than me, and they shared their knowledge, and it was successful. Like what they shared was super, super helpful, and I was able to move forward with the project. A lot of times mentorship, it's a good partnership, but sometimes it can feel hierarchical because you have, sort of the newer person and the experienced person working together. I read this article a while back and it really resonated with innovation, but with innovation, you often have to build a really kind of more omnidirectional mentorship team, meaning that you become this expert on the product or the project or whatever you're taking on. And you may have experts across a number of different areas who you're working with, whether design, engineering, commercialization, business, kind of any of the different components, depending upon the project. But they recognize your expertise and you recognize theirs. And it really goes both of the ways to be able to do effective
Having that
innovation.
mutual respect is important.
Definitely. So the omnidirectional mentorship, the way that this article from Harvard defines it, it's a reciprocal model that incorporates the knowledge and expertise of multiple colleagues and stakeholders within one's workplace or professional sphere. I mean, it helps kind of replace those steep sort of institutional hierarchies with more constructive sort of webs of teaching and learning, where people are working kind of more in partnership as opposed to in the hierarchical structures. But that's something I found really valuable with the innovation journey.
So moving into strategies and competencies. So encouraging the culture of innovation, that's key. We touched on it a little bit before, and just having that leadership support, nurse leaders, managers, they should actively support and encourage innovative ideas from the nursing staff. And then recognition programs for all the work that's going into the innovation by the nurse, having some type of program set up to really reward innovative ideas. And, that not only helps that nurse, but it's going to help other nurses who have an idea. Maybe they didn't know how to come forward, or they, were a little reluctant to come forward. Success breeds success. So the recognition program is very important. Providing education and training. Going into it, you don't know what you don't know. And
So true.
I started out as an entrepreneur, much like Abby. And then the institution I was with, I was able to get the intellectual property back. And that prompted me to kind of move onto myself, or by myself, and with another business partner of mine. I'll get into that a little bit later. But having that innovation workshops, conducting workshops and training sessions on innovation, design thinking, the continued professional development, offering courses much like this webinar, and certifications related to healthcare innovation and technology. So really want to set the nurse, the innovator, entrepreneur, well, most likely entrepreneur if you're in the healthcare setting, but to be successful to move through. And then facilitating, collaborating, and communication. I think that's the key, is really, and Abby had just touched on it a little bit, on interdisciplinary teams. So, you want to have teams from all different disciplines, whether it be physicians, lab personnel, what have you, teams that, and you want to include the nurses, because like Abby said, we are the frontline workers, we're the ones at the bedside. And I've always kind of equated it to being a mechanic. You don't want to tell the mechanic, what tools to put in their tool cart. The mechanic is the best one to decide what tools they have at their disposal. And we see the problems, and we often see the solutions. And then open communication channels. You really want to be transparent. You want to encourage communication throughout the process. And that all comes down to trust and respect. You have that, you're going to have a successful innovation venture. And then time and funding, which I alluded to earlier. You never have enough time or enough money. But having that set up in advance, having funding resources to really move the innovation forward, because it's a very stepwise process to work through. And then access to technology, just ensuring nurses have access to the latest healthcare technology and tools is very important.
Yeah, definitely. That time and funding. And I think a lot of times early on, having some program that helps you get started with innovation is important. Sometimes it's a lot of your own time, I feel like, in the very beginning, but you need to have structures that allow innovators time away from the bedside, and to formally have some way to get mentorship in advance in those spaces to really be successful. And then, kind of talk a little bit in establishing innovation labs and incubators can be super helpful ways to be able to have kind of a set structure.
Right. And working outside the hospital or the healthcare institution, tapping into different universities. I've ran through 3 projects through the University of Dayton. I'll be running a 4th project this coming semester. I've run 2 projects through the University of Cincinnati, just their biomedical engineering, and then also ran something through the Dayton Business School. So really tapping into just the whole ecosystem that's available is important.
Yeah, our team early on worked with Live Well Collaborative back when I knew like nothing about design thinking.
Yeah.
But it was such a valuable process to really learn, to gain that mindset, because they teach you like as you're learning the competencies yourself, and they're helping do some of the work, but they're also teaching you, which can be, that hands-on learning is so helpful.
Yeah, so the value of resilience. So the ability to remain resilient in the face of challenges and adaptable to changing circumstances and feedback. That's the biggest thing here, is resilience, your stick-to-itiveness and follow through, because sometimes as either entrepreneur, as the innovator, these are our babies, and we're trying to kind of get them out of the nest and flying and everything. And there's days where you definitely feel like, Chicken Little, the sky is falling, and that nothing's going to work out or go through, and why am I doing all this? But then, I look at it from, what I've created, which I'm getting ready to get into and stuff, is sometimes you realize, and same with Abby's solution, is that the problem's big, but the solution you create is even bigger, and it has so much potential to touch so many lives out there. And that's what keeps me going, is just knowing that I have 6 children myself. I want them to have affordable healthcare. That's one of the main reasons that I'm doing this, because we see so much financial waste and waste in systems and healthcare. So, you just want to make the world a better place. I always tell my kids, leave your campsite better than you found it.
Yeah, I love that.
So yeah, kind of getting into my story, as I said, I started out as an entrepreneur, and then once I received the intellectual property back, a physician friend of mine, Dr. Roush Baboff, he was always interested in what I was working on and always paying attention and asking questions. And so I kind of took a leap. We were friends, but not close friends. And so I asked him to meet one day before work, and I told him, kind of updated him on what was going on. And I said, I believe in these technologies. I think that we could build a company around it. And next thing I know, within a week, I'm down at a law office and we're getting our first investor. And so he calls himself my Ganesh. He's been my mentor and throughout this whole process. But for the entrepreneur, you're working outside the healthcare institution. Some of the benefits to it is that you have the freedom to kind of shape the direction of your product or service. You have the freedom to kind of leverage external resources. Of course, there's that greater financial risk because you don't have the support of the large institution. So you're taking on that financial risk and the risk of friends, family, and fools, as they say, but but no, friends and family. And then many healthcare organizations, they don't have the resources or skill sets to support innovation. And we talked about this some last night. And I think that's where the great disconnect is we can innovate to no end, but if we don't commercialize it, if we're not set up as healthcare institutions to support the nurses to take that, all right, see the problem, you have the solution, now let's build it into a product and get it to the bedside. Because one thing I've experienced once I branched out on my own and going and speaking to strategics or companies out there, companies don't want projects, they want products. So it's on us to kind of get it to de-risk these technologies and get them to the into the right hands.
Yeah, and it takes a lot, right, to go from idea to something that's actually a product that's ready to move forward and do something more with it.
Right. So I'll get into the problem and solution briefly. So with blood cultures, we have false positive and false negatives, and we're going to use blood cultures if a patient presents for suspicion of sepsis. My personal tie to sepsis, lost my mother to sepsis, a best friend to sepsis. So really getting that accurate blood culture is important. And I understood the problem, but until I started really drilling down, because we always hear 3% false positive rate. It doesn't sound too bad, but when you realize that 8% of cultures are positive, that's really 40% of cultures come back false positive. And so, it's costing the US healthcare system $8.3 billion a year, affects 1.2 million patients, and it accounts for 5.4 million additional hospital stays. And that false positive blood culture comes from the contamination that's in the subsurface bacteria that we can't get to when we're cleaning. So, we think of a clean catch urine that we do for urinalysis. This is more or less looking at it as a clean catch blood culture. So if you're able to isolate that first 3 ml of blood, you can reduce contamination by up to 92%, is what the research has shown. And the other problem, which I think is even a larger problem, is the false negative blood culture. And that comes from the underfilling of blood culture bottles. And I observe people all the time. That's what I do. That's how my brain works. And I see most people are visual. They'll get a color change in those blood culture bottles and they'll set it aside. And so I started researching it, and there wasn't a whole lot of research out there. But the research that I did find was that 80% of blood culture bottles are underfilled. There was a health system up in New York that analyzed 502,000 blood culture bottles over a 4-year period, and not one bottle was appropriately filled.
Oh, wow.
Yeah. So you want to have that 8 to 10 ml of blood to optimize growth to really know how you're going to treat sepsis. I actually think that when we hear that only of cultures come back positive. I think that number is way low. That really due to the underfilling, because the research has shown that 28 to 49% of patients with severe sepsis, they're negative for a bacterial pathogen. And so that could be legit, or it could be also due to the underfilling of blood culture bottles. So the solution that I came up with was a dual syringe technology that's able to collect the first 3 ml of blood and keep it isolated from the other sample. So it's called the initial specimen diversion technique. So we're diverting that first 3 ml blood, then we're able to draw back 20 ml blood into the syringe, and then it has an internal transfer needle. So the nurse just rotates the device 180 degrees and they're able to inoculate the bottles. And so it's a completely closed system that accurately diverts, isolates, and then what we do is that initial 3 ml of blood, there's a couple competitors out there that will just waste the blood. We actually repurpose it. We collect it in either a lavender tube or a red top, and we can send it to the lab for other lab tests that are indicative of infection or sepsis. And then having the syringe-based technology, you're able to accurately determine that 10 ml of blood is going into each bottle. And so why is this important? False positives, false negatives have been a huge problem for a long time. The CDC and CMS, they're in agreement with this now. And starting in 2026, hospitals are going to be required to report their false positive data and their bottle fill volumes due to the underfilling of blood culture bottles. And so in 2029, that's when you're going to see this transition to diversion technologies, to where healthcare systems are going to need to have something in their toolbox to ensure that, one, they're not going to have they're decreasing their false positives, and two, that they're having accurate bottle fill volumes. So I just kind of put this in to show the potential, either of an entrepreneur, but in 2017 formed the company. We've raised a little over $1 million to date, and through for dilutive funding, and then through grants and on awards, we've won about another 300,000. So, but if you would have told me on day one when I first kind of came up with all this and the stuff that I'd experienced, I wouldn't have believed you. You know,
Same.
Yeah. Once we got the intellectual property back, we filed our 2 patents. There's another technology. There's actually 3 dual syringe technologies, but we filed our patents in the US, and then we did international patents. And, you know, typically it takes 18 to 24 months even to get a patent reviewed. Within 3 months, we had notification from the Patent Cooperation Treaty, which is the worldwide database, that we had clean reviews. And so they put us on the patent prosecution highway, and we received our first patent within 6 months of submission. And then our second patent for the technology I was speaking about, we received that in 11 months from that. And so from that point, we're able to grow the patent portfolio to 25 patents. We're patented in the US, Canada, Mexico, India, Israel, Hong Kong, and Japan, and the European Union as well. And so just all this recognition, I always kind of, being the entrepreneur and kind of having to figure it out as you go along, I always say there's never a meeting that I won't take, because it's kind of what you take from that meeting. And I was telling Abby last night, it's just fascinating. It's almost like a game to kind of work through the different milestones and this. And if you meet with someone and they say, oh, you should talk to so-and-so, and then you talk to them, and next thing you know, you're driving up to Cleveland in an ice storm, and then it just takes you all over the place. But you know, I had the opportunity to testify before Congress as an expert witness on upskilling the medical workforce. And then most recently last year, we were selected to participate in Mass Challenge, which is the world's largest non-dilutive accelerator.
That's awesome.
Yeah. So then I won't belabor this. It's stuff that I pretty much had reviewed. We have been in conversation with 3 different strategics. But going back to what Abby was saying is, sometimes that innovation comes before the data and everything that's out there. And just knowing what you've created, and, I had tested it, in my basement and everything, that it actually worked. But seeing when you finally get that validation, we did a contamination reduction study through NAMSA over in the EU, and we had 100% contamination reduction with all the most three common contaminants. And the competitors and the previous research has said up to 92%. We've proven out that we can, even at the higher concentration of bacteria, we can advance it to greater than 97%. And then just the patent portfolio that I spoke of before. And so then when we can go into integrated lessons learned, and I'll let Abby go from there.
Yeah, and both of our project examples are products, but there's all different kinds of innovation. And so the things that we're talking about in terms of creating an innovative healthcare system and creating the capacity for nurses to innovate, I think these really go broader than just product innovation. Those just happen to be the examples that we are sharing and work through. So one thing, really key attributes when you're thinking about mentors and champions, like that's so important with innovation, having the experience and the expertise. So having an innovation track record is helpful. So people have been through the process and know sort of all of these intricate kind of ins and outs and all the things that you don't know is super helpful. And having that relevant knowledge. And I think as I was innovating, just building my network of people who innovate, even if it's not somebody who can formally mentor or champion, just having people to talk with and, talk things out with and be your kind of support network.
Yeah, and I think just we both have witnessed it over the past year, just kind of being an explosion of nurse innovators. We both attended out in Los Angeles back in April or May, I believe it was. And just the nursing innovation community, everybody's wonderful. They support each other. We went to Chime, which was a healthcare conference, MedTech, and they first time that nurse-led companies were there, and they had 6, and we're going back into health conference down in Las Vegas, and now that's gone from 6 to 30 within 6 months. That's we're
great.
bringing a whole army of nurse innovators.
I think Magnet this year is doing a focus on
nursing
innovation, like specific companies in their expo too.
Yeah.
So it's great, like you were saying, like the community across the country has really grown and really is just so supportive of each other, which is amazing, because innovation can be a very competitive space too, but nursing innovation, I think, has really grown to be a really supportive kind of community.
Yeah.
So in leadership and influence, really just, I think having leaders who have the authority to help make decisions and move things forward, particularly is helpful in a healthcare organization. But like Mick was talking about, and like I mentioned, that mutual respect, where your innovator may be somebody who's brand new to the space and they may know way less than the person, who's supporting their project, but they know way more in the project itself and certain things about kind of the specifics at the bedside. So it's really that partnership and that understanding of each other's expertise, I think, that helps you advance innovation so well, and decision-making power. And I think of both of these kind of like when I've done quality improvement projects too, right? You need to have your champions within your department that are able to support that. And I think it's similar with innovation. Otherwise, you can have all the ideas in the world, but if you don't have the ability to implement them in trial and test and have somebody that's championing something new and different, it's a lot more of an uphill challenge. Do you want to, you can do this if you want.
The support and encouragement.
Yeah.
So supportive and encouraging attributes, you want the mentorship skills, should be able to provide guidance, support, and constructive feedback, and an encouraging environment, just having that positive, encouraging, welcoming environment. And I think that's for those healthcare institutions that are thinking of starting an innovation department. I think having that space, that mental space and physical space where the nurse can go to really work on their solutions and be, surrounded by other innovators and nurses would be important. And communication and interpersonal skills, that's just key. Because sometimes you might be communicating with your mentor every single day, you know, early on in the project, but having that effective communication and that mutual respect going back and forth is really gonna be important to continue this project or continue the project to success. And networking abilities, just they should be able to have a strong network within and outside the organization to kind of facilitate collaboration and support. And then commitment and availability is, like we said, it's I've been at it for going on 8 years now, both through the being an entrepreneur and entrepreneur. So it's a time commitment. So, you know, having a mentor that's going to ensure that they have the time to dedicate to mentoring and supporting the innovative process is key.
Yeah.
And then long-term involvement. Guys. They should be willing to stay involved throughout the project, you know, strategic vision, forward thinking. You want someone that has the strategic vision that can see the bigger picture and all the downstream effects that this is going to have. And then alignment with organizational goals. And they should be able to understand and align innovation efforts with the broader goals and objectives of the organization. And then excellent problem solving skills. You know, as nurses, that's what we thrive on. We have excellent problem solving skills, but we want our mentors to be resourceful and have analytical thinking. And then a passion for innovation. That's the most important. You want someone who is going to be your biggest cheerleader, but in a way also your biggest critic. You want that enthusiasm and energy and just to kind of so that you can feed off of that. And then just that inspiring role model. They should be able to inspire and motivate others to think creatively and pursue innovative solutions. So by considering these attributes, you can select an innovation mentor and champion who will effectively support and drive the success of your innovation initiatives.
Yeah, and it might come from multiple people, right?
Right.
With your innovation work. So, and then some competencies that promote nurse-driven innovation, you know, and these really tie directly into, I think, a lot of what we've already
Right.
talked about today. But, you know, having critical thinking and problem-solving skills, which nurses already learn, which is amazing. The creativity and open-mindedness. We don't always think of our job as being creative,
Right.
but you give us a problem that's not working and we'll find a way to fix it. And that's creativity.
I think every shift we have to be creative. I mean, just to function. I forget what is it, 28 workarounds a shift or something that nurses experience.
Yeah, to keep things moving and going
Yeah.
and working every day. Then technical proficiency, you know, leadership and advocacy. A lot of times in innovation, you know, you're doing something completely different than a lot of people surrounding you. So
Right.
really being able to develop those leadership skills and advocate for what you're doing and working on. Collaboration and teamwork, which we've shared a lot about, those communication skills and knowledge of healthcare systems, because at the end of the day, it really is about improving health and healthcare. So those are all so important competencies to build in nurses for innovation.
Yeah. And we'll close with this. So just by fostering these strategies and competencies, healthcare organizations can empower nurses to lead and drive meaningful innovations that enhance patient care and operational efficiency. So with that, we thank you for your time and we'll open it up for any questions that might have come through in chat.
Okay, so there are no questions yet. If there are any, you can also, and if you don't feel like typing them in, you can also speak them out loud. That's totally fine too.
Yeah, happy to answer really
Yeah,
anything.
yeah.
We covered a whole lot of ground, so
Yeah.
any
that's a lot
area
to
that's
take in.
any area that's of interest to you, feel free to chime in.
Okay, so I was going to say there might not be any questions. It looked like you thoroughly handled the presentation. And if
Yeah.
there are any, we can definitely send out your contact information and folks can reach out to you individually as well. And we do got a little comment from Nick. Awesome information and congratulations on the success. Thank you, Nick. It's good to see you.
Thanks.
What
I would
else?
mention too, like LinkedIn, I think
Yeah.
for nursing innovation has been a great place. Like we're always happy to
Mhm.
connect with
Yeah.
nurses, but I found that community has been a really quick way if you're interested in innovation to build a network of people who are doing really cool stuff and are willing to help.
Yeah, and I'm always open to, if, because I think a lot of, as nurses, we come up with an idea and it's just, where do you start? It feels so, overwhelming. And like they say, how do you eat an elephant? You eat it one bite at a time. So happy to, if you contact me on LinkedIn to kind of get back to you and kind of help you get through the process.
Yeah, it's kind of figuring out those first steps.
Right.
Right. I had my idea in my head for like several years. And then I had a cousin who worked in product development. And when I shared it with him, he's like, well, you should just make a prototype. And I'm like, I don't do prototype. Like, what do you mean make a prototype? And he's like, no, it doesn't have to function. You just kind of pull things together. And so I literally just like found an app on my phone that already existed, plugged in a standard microphone headset, taped it to an anesthesia mask. And I was like, this actually works.
Yeah.
So that was the start. So, prototypes can be as simple as drawing
Yeah.
something out, cutting out pieces of cardboard, like.
Yeah, mine was working with Legos and
Oh, nice.
toys. My oldest boys now, they were, pretty young and they would be playing with the toy and I'd say, hey, let me see it. And my twins, they had kind of speech impediments and they'd say, please don't take my toy apart. But I would take the toys apart and I'd say I could use that to prototype. And a lot of my first prototypes, I probably prototyped out for less than $2 and they actually worked. So
Yeah, it's just getting
Awesome.
creativity going.
yeah.
I was going to say, are there any other questions, any thoughts, comments? Okay, well, seeing none, just a couple follow-up points. I will send out the CE application, so please don't bother any of our presenters. They will not be able to get you the CE application. That will be me. I'll do that within usually about 5 to 10 business days. So just be on the lookout for me. This is, like I mentioned, recorded, so information will be online within the college's YouTube channel within usually about 2 weeks as well. We'll cut it down and trim it. All this will be left off. So, but if you do want to share this information with other folks, it will be available online. Lastly, I will share the presenter's information when I send out the survey that we do ask you to complete. So if you do have questions, you can just reach out directly to either Abby or Mick, and they'd be happy to chat more.
All right. Thank you, everyone.
Yeah, thank you so much.
Bye.
Thanks, everyone. Have a wonderful day.
Mhm.